Hello everyone. Today I'll be presenting my final project titled Green Space as Public Health Infrastructure, a scalable model for urban climate resilience. This project explores how green space can be a powerful public health intervention for climate resilience and equity in Chicago. To begin, climate change is more than just an environmental issue, it's a growing public health threat. According to the World Health Organization, climate change is projected to cause an additional 250,000 deaths annually between 2030 and 2050 due to heat stress, malnutrition, and vector-borne diseases. This was based on the article by WHO published in 2021. In the US, the CDC reports that over 700 people die from extreme heat each year, and most of them live in urban, low-income neighborhoods. This was based on CDC published in 2024. Chicago's south and west sides, like North Lawndale and Englewood, are disproportionately affected by the urban heat island effect. These areas were historically redlined and underinvested in. Hoffman et al. Published in 2020 found that formerly redlined neighborhoods are up to 7 degrees hotter and have higher rates of asthma and cardiovascular disease. These health burdens fall hardest on Black and Hispanic residents, seniors, and children. For the proposed intervention, this project proposes installing 5 new green spaces in high-need Chicago communities. These would include shaded parks, community pathways, and redesigned schoolyards. The initiative is modeled after Chicago's Space to Grow program, which converted asphalt schoolyards into green infrastructure. This was based on the article by OASH published in 2022 and Philadelphia's Green City Clean Waters, which combines stormwater management with community engagement. For the evidence-based approach, the benefits of green space are well documented. Wolf et al. Published in 2020 showed that urban greening is associated with 1 to 18% increases in physical activity, reduced heat exposure, and better mental health. These improvements translate into lower emergency room visits and public health costs, making green infrastructure a cost-effective, scalable intervention. Our implementation plan unfolds over 18 to 24 months across 4 phases: community engagement, site selection, construction, and maintenance. We'll use GIS mapping to identify hotspots, hire local workers, and install features like permeable pavement, shade shelters, and native trees. Public art and bilingual signage will ensure cultural inclusion. To evaluate impact, we'll use a mix of community surveys, public health data, and GIS heat maps. We'll compare pre- and post-intervention emergency room visits for heat-related illness using data from the Chicago Department of Public Health. We'll also use thermal imaging to track changes in surface temperature, adjusted for air temperature to reduce weather-related bias. Mental health and activity levels will be assessed using validated surveys like the SF12 and IPAC. Our SMART goals are specific and phased. First, we aim to install 5 green spaces in 2 years. Second, we hope to increase outdoor activity by at least 10%. And third, reduce heat-related emergency visits in those areas. Lastly, we aim to improve community-reported mental well-being based on follow-up surveys, all within a 2-year window. This project promotes social justice by reinvesting in communities that were systemically excluded, local hiring, culturally inclusive designs like murals and multilingual signs, and ongoing community feedback loops ensure residents are co-creators, not just recipients of change. This is about healing spaces and histories. Our strengths include strong evidence, replicable models, and community-led design, but we must also recognize the limitations. Outcomes like reduced ER visits depend on broader systems. Self-reported data may be biased, and comparing surface temperatures is tricky without accounting for air temperature. Future evaluations should factor in broader environmental changes. In conclusion, urban greening is more than beautification. It's a public health intervention rooted in equity, resilience, and justice. With thoughtful planning, community leadership, and data-driven evaluation, this model can be scaled to cities across the country to combat the health effects of climate change. And then finally, here are all my references I've used. I hope you guys enjoyed listening, and thank you so much.